Good afternoon and welcome. I'm Holly Rosewood from the Pulitzer Center. Thank you for joining us for today's conversation. As we wait for more people to join in, please let us know in the chat where you're listening in from. For those who have not joined us before, the Pulitzer Center is a nonprofit journalism and education organization with the mission to elevate public engagement with underreported issues. We're based in Washington, D.C., but our staff and our work are global. We support more than 170 reporting projects each year in collaboration with news outlets around the world, bringing together this work by themes on our website, including racial justice, migration, public health, and more. And we don't stop with the reporting. Our education programming spans from elementary schools to graduate degree programs and outreach to the broader public. A few logistics as we begin. You'll see a Q&A icon on your screen. That's where you can add your questions as soon as something comes to mind during the conversation. There is also a chat icon on your screen, and we'd appreciate it if you'd use this box only for specific technology issues. You'll also note that all attendees are muted, but if you can't hear us, please let us know in the chat box. We also want to let you know we are recording this session, so we can post it online at a later date. And one final note, please remember to stay online once the conversation ends to participate in a brief survey. We'd love to know how we can improve our programming for you. Now I'd like to introduce today's moderator. Dr. Thea Wilshire is a psychologist, author, and educator with over 2 decades of work in healthcare delivery and consulting through Indian country. She helped develop statewide training programs on multi-jurisdictional and voluntary commitment processes involving tribal and county courts, worked with an intertribal task force seeking federal Medicaid legislation changes to support correctional healthcare in Indian country, and helped create the first tribally run postdoctoral training program for Native American psychologists in the United States. Thank you so much for joining us, and I'll now turn it over to you, Thea.
Thank you. Good afternoon, everybody. You have tuned in to an extremely important topic that has not had the amount of discussion or exposure that we have wanted. So it is my privilege to sit with our esteemed presenters. I am going to first have Chris Yazzie. Chris is a member of the Navajo Nation. He has 4 multi-generational granddaughters. He's a registered nurse. He is going to share with us some of the story of his brother who died in a tribal jail where he worked and where his mom worked. So somewhere that they had experience with. There's more on each of our presenters on the website, but following that, I'm going to turn and bring on Chrisnate Hedgy, who is going to talk to us about some of his wonderful reporting. He's with Mountain West News Bureau. It's a consortium of NPR stations, and he's had national and international exposure for his work. BBC, CBS, NPR. So Chris is then gonna, Nate is gonna then expand. So we'll go from the personal that Chris is bringing. He's gonna expand and tell us some of the stats. And then we're gonna bring in Brandi Tomhave. Brandi is a member of the Choctaw Nation, and she has really dedicated her legal career to untangling issues of health disparities and things that impact tribal sovereignty. She has lobbied for all sorts of things and works closely with the Navajo Nation. So that's our plan. And Chris, I would just love to welcome you to the webinar. Please take on.
Yeah, my name is Christopher Yazzie. I had a brother named Carlos Yazzie who passed away in the detention center in Shiprock, New Mexico, and you know, I'm honored to be here to sort of represent him and you know, to sort of tell his story, I guess. My brother and I grew up in a little town called Tisnaspas, Arizona. And we were raised in alcoholism. You know, my stepdad was a Vietnam veteran who was probably suffering from PTSD. And we grew up with a lot of alcoholism, and we were both physically abused. And as a result, I think that we were, probably dysfunctional, you could say, as people. But my brother, battled alcoholism for the duration of life. I myself, thankfully, was, delivered from alcoholism 21 years ago, and took a little turn there. But my brother continued on and was in and out of the jails in Shiprock, and was often, told me about times that he was mistreated by the Navajo police. And I think that it just got to the point where, the police officers were probably desensitized to my brother's my brother's alcoholism. And the night that he died, he was, it was documented that he was asking for medical attention. And basically he was, laughed at and ridiculed and put away in a cell, neglected for the night, and found dead the next morning, unfortunately. And even after that happened, we weren't informed that he was transported to Albuquerque for an autopsy. We weren't notified until after he was already there. And even then, we were stonewalled in pursuing answers as to how, everything transpired. And it wasn't until Nate came across with documents explaining, the events of that night, and also the behavior of the police officers regarding my brother's pleas for help, and their negligence, and quite frankly, their rudeness was something I had suspected right from the beginning. But I'm thankful that we have more of the truth now, and that possibly we can prevent this kind of stuff from happening more.
Thank you, Chris. Nate Hegyi, will you give us a little more understanding?
Yeah, it was wonderful to meet Chris, and I was, blessed enough to have him share his story. And his brother Carlos isn't alone. At least 19 people have died in custody at jails overseen by the Bureau of Indian Affairs and the federal government since 2016. And unfortunately, Carlos's story isn't unique either, in the sense that a lot of folks are coming into these jails. Carlos's the alcohol in his blood was I think something around 0.400, 6 times the legal limit, a very dangerous amount, the kind that you need to go to a hospital as opposed to a jail to seek medical treatment. He didn't get that treatment. He was left unmonitored for 6 hours and passed away that morning. And we saw time and time again similar stories on the Blackfeet Reservation, out in North Dakota. These folks that are coming in, either going through withdrawals, struggling with addiction, and not getting care from medical providers, but instead being looked at by correctional guards who, as one man told me, we're not doctors. We don't have the tools and the resources to be able to do this. And so we spent about 6 months on this investigation, myself and the team at NPR's Stations Investigations Unit and then the Mountain West News Bureau, digging through what documents we were able to get from the federal government, stuff we were able to find, jail records, law enforcement records, interviews. The biggest thing, though, was interviews with family members like Chris, people who were willing to share their stories about what happened to their brothers, sisters, moms, dads, sons. It I think shocked us all, just the kind of treatment that some folks received in these jails. And there's since, when our story came out, the Department of the Interior announced that it was launching a third-party investigation into and review of the BIA detention centers. They said it was going to be top to bottom review. There were calls for action by senators and representatives. And since that, we do know that the review is almost done. I just found out last week, or earlier this week, I should say, the third party that's going to be doing it. So we're hoping to produce a story here in the next couple of weeks about that. Not about the review, but just about kind of what they're looking at, what the scope is. And then we'll just continue to follow up as more and more happens. But yeah, I just wanted to say again, I've just been so thankful to meet Brandy and Chris and everybody else through this story, and kind of stumbling upon a very serious issue that just wasn't getting a lot of attention at all.
Thank you, Nate. I see that some of you are starting to put in questions. We are going to finish with the presenters just at least doing an intro of some of their background and ideas and discoveries. Then we're going to go in the second half of the webinar will be question focused. So we're not missing you. Brandi Tomhave.
Thanks, Thea. So my husband, Jeff Tomhave, and I have been working on this issue for nearly a decade now. We were brought into this issue by Tuba City Regional Healthcare Corporation, which is a nonprofit tribal healthcare center in the Western Agency of the Navajo Nation, about 50 miles as a crow flies northeast of the Grand Canyon. At that time, which was approximately 2011, there was a new tribal jail proposed to be constructed in Tuba City. And that jail's profoundly needed. I believe it was in about 2011 that the US Department of Justice's Inspector General did a report about the state of tribal jails. And what he found is that they're egregious. And so the Obama administration allocated a sizable amount of funds from the American Recovery and Reinvestment Act, better known as ARA, to go out into Indian country to replace these jails that are overcrowded. As Nate already mentioned, the physical conditions of these jails are something more like you would imagine in a third world country rather than, say, Arizona. And so that was very good news and very exciting. Our inquiry started very innocuously. We just wanted to know, and when I say we, I mean the local tribal healthcare facility wanted to know how to coordinate healthcare with this new facility, assuming that this brand new day in tribal corrections in their part of the world would bring with it finally healthcare inside of the facility. The amount of pushback that we got led us on an odyssey that brings us here today. And what we found was that there was not only no intention, but no willingness of the U.S. Department of Justice, who was the grantor of these funds, to even entertain this conversation about corrections healthcare inside the facilities that they were helping to build. They pointed the finger at BIA and said, these are BIA facilities. They are BIA inmates who will be housed in these facilities. This is entirely BIA's problem. We went to BIA over and over and over again. And BIA said, hey, we just incarcerate people. We're not responsible for their health care. That's IHS, Indian Health Service. And and we don't have a budget for healthcare inside tribal jails because that's not our responsibility. IHS similarly does not have a budget for corrections healthcare. And I just want to say up front that corrections is a primary healthcare specialty. It's not like, just any other kind of healthcare. But neither of the primary federal agencies that have primary responsibility for American Indians and Alaska Natives have any budget to take care of tribal inmates inside of tribal jails, neither BIA nor IHS. We wondered, well, who takes care of federal inmates in other federal facilities like Bureau of Prison Facilities or ICE facilities? Because qualitatively, categorically, they're no different than tribal jails. They are detention centers for which the federal government is responsible and funds. And they seem to manage to provide healthcare inside to inmates. And that is provided by the Public Health Services Commission Corps. Public Health Service is an agency within HHS. So we talked to them. And for, I think now it feels like 10 minutes we had hope. It was actually much longer than that, because the leadership at that time at Public Health Service readily acknowledged the role that they could play that could be transformative in this whole issue. Because in fact, they have the capacity and the knowledge and the relationships to make this happen, to provide medical care inside tribal jails. And we were hopeful that they would forge a partnership with BIA and to make this happen. Had they done so, we may not all be sitting here today discussing this. But so far, literally nothing has happened at a national level in the decade that I've worked on this issue. So I'm very grateful to join you today to be a part of this really important discussion.
Thank you. Thank you, Brandy. A couple of things that you did not touch on, and I would like, Nate, if you could pop in on some of the discoveries you made about what is available and what tribal correctional officers should be getting. But Brandy, if you could then explain, why is this not Department of Justice? Why is this not Medicaid? What stops those funding sources from helping this small pocket? It's the only one that's being missed. So what happened?
Well, strictly speaking, Department of Justice's responsibility was really just to help get these facilities built. These facilities are administered by and overseen by the Bureau of Indian Affairs, Office of Justice Services at the U.S. Department of Interior. And, whoever incarcerates somebody has responsibility for that individual. And so whoever is responsible for the corrections system ultimately has ultimate responsibility. But to be fair, here, I think BIA is in a very difficult situation because they do not have the expertise. They do not have any healthcare personnel. I think that the federal system of care and service delivery for American Indians and Alaska Natives is so siloed that in separate agencies, in separate federal departments, where you have situations like this, it really requires a bridge to be built between the two. You have a real challenge. Healthcare is provided by Indian Health Services at HHS. And their feeling is, and they are correct, that these tribal jails are outside the scope of their system. They're right. And so that's why I pointed to Public Health Service, because they are the federal department or agency within HHS that has uniquely, created systems of care inside of federal correctional facilities. And even where a tribe has contracted to administer a tribal jail, at the end of the day, they've contracted that authority from BIA, from the federal government. And so the federal government cannot contract away their ultimate responsibility for whatever happens inside those facilities.
Thank you. If all of the acronyms that are being shared are a little bit overwhelming, we are going to have a link to white paper that the Tomhaves created. It really summarizes the issue about the fact that once someone's incarcerated, their Medicare, Medicaid cuts off, and that is the primary way that healthcare is being paid for in Indian country, but they cannot keep it once they have been adjudicated. Now, the other issue is that most jails, your state jails, your county jails, they use property tax to fund healthcare. unfortunately, Native Americans cannot charge property tax because it's federal trust lands. So this is part of how this little thing fell in the middle. And it seems like it should be a fast solution, an easy solution, but it just isn't grabbing the decision makers in the way we want. Nate, I had directed something to you earlier. Are you able to explain some of what you discussed?
Yeah, essentially what you're talking about is this gap, right? Between all these different jurisdictions and everything else like that, there's this gap. You know, I think it's really, really important to note, and I should have noted earlier, there's no on-site medical personnel at these jails. That's very different than a lot of other places where people are incarcerated. You don't have a public nurse that's there to just check out and say like, hey, this person, their BAC is off the charts. We need to get them to a hospital. They need to go through detox, or I'm going to be here. I'm going to monitor them as they go through detox. That's not something that we see at, there's no requirement for that to happen at these jails. So instead, it's a correctional guard's responsibility to go through a checklist and to make these sometimes life or death decisions about people. And they've gotten it wrong a handful of times. And then beyond just this kind of health care aspect, there's also just plain negligence, people not checking on inmates who are sick for hours on end when they're supposed to check every 30 minutes. And that's caused people to die, not knowing what to do when there is a medical emergency, when someone does drop because they're having a heart attack or they're having a hard time breathing and they're asking for help, not grabbing that defibrillator quickly enough, not performing CPR, performing it too slowly, waiting 10 minutes to help somebody. One woman had a seizure. It was caught on camera. Guards didn't respond. Her cellmate was pleading for help for them to respond. They never did. And she died from an alcohol withdrawal seizure. And so these are these gaps, we kind of talk about all this alphabet soup, but at the end of the day, this gap is frankly a deadly gap. And a big reason why is because there's no on-site medical personnel at these jails.
I'm going to jump to one of the questions. Joel has asked, do you have a psychotherapist program for the social reintegration of citizens who were in jail? Joel, it goes way farther back than that. And being the psychologist on the panel, I'm going to grab this one. There are no medical, there's no counseling, there's no substance abuse treatment happening in the jails. If it is happening, the tribe is absorbing all the cost. So with my outpatient mental health and substance abuse clinic for the San Carlos Apache Nation, we would send staff in and we just had to eat the cost. So there was no way to reimburse, and there was no way to, if we couldn't bill for the service, then we couldn't actually expand or bring in more staff. And while that person is traveling to the jail, waiting to be cleared, going through, checking on the person, all the reverse, there could be 5 people at the clinic in crisis who didn't get any services. So there aren't services. If there are, it is just something, the medical and the mental health is something that's being given by the tribe because they want to take care of their people. They want to care for their tribal members. Something that I didn't hear you guys say yet is just why healthcare needs are actually more acute in a detention or correctional setting. Chris, I don't know if I should put you on the spot or who wants to answer this one, but it is a more acute need.
Yeah, in the case of my brother, it was obvious that he, reading the reports that he, made it known that he felt like he was in distress, and basically the corrections officer actually correctly requested a medical clearance before they would admit him into the jail. But that corrections officer, who actually was unqualified, undertrained, was overruled by the police officer. And that's where I believe the biggest the biggest break in the chain was with the police officer, not having any medical training, or even being aware of when to reach out for medical resources. And as a registered nurse, it was very appalling to read about how they treated him. And not only was that officer negligent and disrespectful to my brother, but also there was another officer and a sergeant there who were all together laughing at my brother. And none of them, I'm assuming none of them had any medical training to recognize, when a person's in medical distress, even if somebody's there actually requesting medical help and explaining that they feel, they're in medical distress. So yeah, I think having, even, maybe not even a registered nurse, but even just having somebody there to intercede for somebody on a medical level, or just advocating for somebody to get medical attention would make a great difference. Because I think the police officers themselves, I think, tend to get their own personal feelings involved, and I don't think they have the training to be objective with their help. And I think, especially if it's like a difficult arrest, I think they're more likely to ignore the person's needs, or recognize a person's situation, as they did with my brother. I think my brother was at some point, it was probably obvious that he was dehumanized, and it takes training. I mean, as a registered nurse, I've been through training to recognize that you have to put your personal feelings aside and do what you have to do on a professional level. And that training, I think, is non-existent.
And you're talking about a much higher level of medical training, but even the basic of first aid. Nate, you reported that even that's not happening the way it is legally mandated to do so for correctional officers.
Right. Every correctional guard is supposed to go through IPA training, or similar training. IPA is Indian Police Academy training to become a correctional officer, or something at a state level that's comparable. I think we found something like 1 in 5 correctional officers haven't received that training. That training includes first aid, CPR, that kind of thing. You also have options to get CPR and first aid training on the job as well. But we noticed time and time again that, whether or not they got that training, or whether they just didn't bring that training to an actual life or death experience, there were gaps in the minutes between someone stopping breathing or having heart trouble and actually dying, where a defibrillator wasn't used, where CPR wasn't performed soon enough, or 5-10 minute gaps, as I said before, between when someone falls down and actually getting the care that they need. And so, yeah, even these basic kind of things like CPR training that all correctional officers should have, in some cases weren't being enacted.
Brandy, you were starting to say something earlier.
Yeah, I just wanted to answer your question this way. Why is it so important to have medical care inside of a corrections facility? And I want to step back and basically step outside of Indian country for just a moment to provide context. I started my career as a public defender in California, and in that capacity, spent a lot of time in jail. And that's when I first learned firsthand of, sort of the health issues that a typical inmate has. I mean, I think that in the majority of cases, there's going to be, at a minimum, of substance use disorder, coupled with mental health disorders. They typically go hand in hand. And in addition to that, there are primary healthcare needs. And oftentimes an individual is diagnosed for the first time when they get into jail, when they get arrested. Their lifestyle, is chaotic at best. And they're not getting the health care that they need, and their activities are probably oftentimes exacerbating, underlying conditions. So it's not at all unusual for inmates to have chronic diseases, such as liver disease, kidney disease, diabetes, as well as communicable diseases. I think any corrections officer, anyone with a passing knowledge of corrections recognizes that HIV, AIDS, Hep C, and tuberculosis are likely to be found, or something that you want to, very strictly guard against inside a corrections facility, because just they really, those communicable diseases tend to thrive in those kinds of settings. And that's true across the board. There's nothing unique in Indian country about that. That's just sort of at a threshold level. Now let's step onto a reservation, in Indian country. And what we know, and what a GAO report that came out this year, just a few months ago, underscored for all of us, is the healthcare disparities in tribal communities as opposed to everywhere else in the United States. So American Indians and Alaska Natives suffer from chronic disease and rates of mortality that far exceed most other Americans. So you have populations that are sicker, who do not have access to the same kind of health care that other Americans enjoy. And then within that, so that's just the general population. And then within that subpopulation, when we're talking about inmates, I believe, please correct me if I'm wrong, but I think that the percentage of tribal inmates who are arrested, who have substance use disorders, who are, drunk or high when they're arrested, is about 95%. And it's really important, critical for those folks to have access to primary care, not only upon entry, so there's a whole screening issue, but now let's, move into the next chapter when they're there, and they're there for, any protracted amount of time. If they have an underlying chronic disease that and need for medications, ongoing medications, the medications need to be distributed and monitored by medical experts, not guards. And they need to be able to have access to treatment. And with the benefit of broadband, telehealth is now an alternative today that is a new opportunity. And that's an opportunity that BIA and IHS and Public Health Service should be talking about, and together, partnering together to try to, at a minimum, make that available as quickly as possible to tribal jails. That's the low-hanging fruit, really. And but right now, they're operating in tribal jails are sort of operating in a medical vacuum. And the only alternative is for guards to take folks to the nearest healthcare facility. And doing so destabilizes the safety of the detention center, because it takes guards away, correction officers away from the site, and thereby, of course, depleting their numbers on site. You have fewer boots on the ground inside the jail because they're over at the emergency department. And I think that I don't know about you, but if I were hearing about this for the first time, I would automatically imagine that somebody would be taken to emergency because of some kind of like a fight or a traumatic event. But people are also taken to healthcare facilities for chronic underlying conditions. For example, there's a gentleman in the community that I tend to work in very closely, and he had inmate with kidney disease. And so he was taken to the local tribal healthcare facility 3 times a week for dialysis that takes 3 hours each time. That's 9 hours of correctional officer time being spent sitting in a hospital corridor waiting for the inmate. And I'm not suggesting necessarily that the tribal hospital is going to be able to provide dialysis, but they should be able to that should be the exception, not the norm. And unfortunately, that's the norm today. It's the worst way to provide corrections healthcare in terms of clinical outcomes, in terms of facility stability and safety, and cost efficiencies. It is the absolute most expensive way for everybody involved to access and provide care. It's expensive for the tribal healthcare facility, and it's very expensive for the tribal corrections facility. And it's a cost that's being unfairly borne by tribes themselves. It's a burden that they're shouldering because the federal agencies have refused to step up and deal with this.
Nate, you were moving forward. Are you wanting to weigh in on that one, or should I jump?
No, I think Brandi, hit the nail on the head in terms of, something that I wasn't able to cover as much in the story was that kind of use of correctional officer time, not only, sitting with somebody, doing dialysis and leaving maybe the only other correctional officer on duty by themselves at the jail, but also transport. One thing I noticed at the Shiprock facility in the Navajo Nation was that, if you're short staffed and you've got 2 correctional officers, and, Shiprock, that facility was so dilapidated. Was it Shiprock or Window Rock? Window Rock was so dilapidated. Both Shiprock and Window Rock were pretty dilapidated buildings that they weren't allowing people to stay more than 24 hours, or they weren't allowing them to stay over the weekend. It was just a temporary holding facility. And so they would have to drive, inmates sometimes 2 hours to the nearest, big facility, and leaving potentially another correctional officer by themselves watching over inmates, as they burn 4 hours driving to and from a different correctional facility, which just goes to highlight that, they're chronically understaffed at these jails and chronically underfunded, something to the tune of $240 million need by the BIA. The BIA itself says would properly fund these jails. That said, BIA and the Department of Interior have never asked for that amount of money. So there's also a gap there. They know how much they need, but every time they go for their budget justifications, they don't ask for that amount.
I'm going to bring up, we got a couple questions coming in. Carly has asked, as being a minority, why haven't they combined resources with other minority groups? This is upsetting because they are US citizens as well. There's so much talk about prison reform. That I know that's going to be a very long topic about why Native Americans are being treated differently. Is anyone able to respond to that in 3 minutes or less?
I'll take it. At least I'll start. Okay, so American Indians and American Indians are uniquely situated. They have a different and special relationship with the federal government based upon treaties that were entered into by tribes with the United States. So the services that American Indians receive are really, it's payment that's due, right? They have already paid upfront for these services by way of land and resources that were negotiated and settled and perfected in treaties. And so now we're just enforcing what amounts to legal obligations that are articulated by treaty and statute, and the federal government is failing, to honor those obligations. And so tribes have a government-to-government relationship with the United States based upon the fact that they are sovereign, they're domestic sovereign nations. And so their tribal members have a different relationship with the federal government than any other American citizens, and the federal government has a unique responsibility for their health care.
Carly, if you want more info, we've got, I would definitely direct you to the white paper that the Tomhaves prepared for Congress, but I also would say jump in if you haven't yet and read Nate's series of articles. Fascinating stuff. Tanya's asked a question, and Tanya, this is how I wanted to end. And so in the last 20 minutes that we have, I would like to just kind of do almost a rapid fire question and just work along the line. I'd like you to tell us what you think is the primary. I mean, there's tons of problems that are leading into this, but what do you see as the biggest issue? And what do you see as the biggest solution? But let's start with the biggest problem. Nate?
Yeah, from my reporting, I would say that the biggest issue, the thing that popped up time and time again, was a lack of on-site medical personnel, trained medical personnel at these jails. I would say that could probably go a big ways to rectifying the situation. I think that, the solution in a sense is monetary. And it's, whether it's the Public Health Service Commission, getting federal nurses, it doesn't have to be physicians, it can be nurses, it can be physicians assistants, someone into these jails, I think would be great. And I know that question mentioned legislation, has there been any legislation introduced? When you're talking about incarcerated people, it's a really uphill battle. And when you're talking about incarcerated Native Americans, it's even more of an uphill battle. So there hasn't been any legislation introduced. There are your usual calls for action by lawmakers, which is pretty easy to type out a tweet or write out a statement and send it to a reporter. There hasn't been any kind of committee hearings on this. There's been whispers of it and talks of it, but right now with the infrastructure bill and the Build Back Better Act, there's not been a lot of bandwidth for this issue. And so legislative wise, we're not seeing anything. And there's also not a lot of these issues, like when I look at like the missing and murdered Indigenous women's crisis, there was a grassroots kind of growth that came there and started pushing this issue in front of Congress people. And it, after decades of kind of being undercovered, it's having its moment now, and it's finally starting to receive attention from the federal government, but it takes a lot of grassroots action to make that kind of stuff happen. And so, this is just freshly becoming more public. And so I think there's still a lot of work that would need to be done to rectify some of the situations, at least at a legislative level.
Chris, biggest problem out of all this? And I should have said probably one sentence or two. But go right ahead, Chris.
Yeah, I would just say more training, for the police officers and the corrections officers, even having a set of things to take vitals, a pulse oximeter, just to get a pulse rate, just, basic things like blood pressure. Cause you can teach anybody this stuff, just some basic things just to give them an idea of how much distress a person's in. And then having the justification to transport that person or turn them over to a medical personnel.
Thank you. Brandi? Biggest issue in one sentence or two?
Leadership and human decency is the biggest problem. Both are lacking in Washington, D.C.
Thank you. For me personally, because I was the clinical director, I don't know that it's the biggest problem, but for me, the easiest solution is just a couple of words change in Medicaid language at Congress. Just a couple word difference that they could even tack on to another bill, and then tribes could at least get reimbursed for the expenses that they're putting in medically and substance abuse and mental health. That to me is very, very low hanging fruit. Then we've got public health, we've got Commission Corps, we've got all these different ideas. But Chris, what do you see? If we're doing a call to, you know what, we've got 15 minutes. I'm not going to speed us along. I apologize. What would you want people to know? What would you hope they could do to make a difference on this issue?
I think now in the age of social networking and the broadband capabilities that are even expanding on our reservation, just people to become active online, and just advocating for, somebody like my brother. I did notice that when I put this information out about my brother's, situation. Not a lot of people were responsive to it. And I just think that, that we need more people that are more experienced in advocating for this population, because, there's a lot of shame. There's a lot of, finger pointing, and when it comes to alcoholism, it's something that, it just seems people would rather just not hear about it or see it swept under the rug. But I think that there needs to be more representation of these people, and I appreciate what Nate's done, and what we're doing here today to kind of make light of these issues. Just more of a public awareness, about how these people need to be treated as human beings, and not leaving it up to the sole discretion of an arresting officer or a corrections officer, in making, potentially life saving decisions.
Brandy, you had said we just need to call a meeting between which key people that have not talked to each other? The head of BIA and the head of
Public Health Service. So I actually have written their names down because I have a poor memory for names, but what we need is Director of BIA Daryl Account to have lunch with Captain Brian Lewis, who is the new director of the Commission Corps of U.S. Public Health Service. I'll treat. They should go to lunch and discuss this and see how their two agencies can work together and articulate what that would look like, how much it would cost, and then what they need to do is to convey that to Congress. Their first and next opportunity for them to do so, beyond, in the form of a phone call or a letter, but the first formal opportunity to do so will be early next year during the annual appropriations hearings that happen both in the House and the Senate. And so something that we can all do is to email a letter, a message to both the House and Senate appropriation committees and flag this issue for them and say, hey, when representatives from BIA and Public Health Service come before you next year arguing their budget, we'd like you to ask them to talk about this issue. Why aren't they making sure that there's medical treatment inside of tribal jails? And how much would it cost to provide that? Because we can make this happen next year. And I think that, Chris's family has experienced a tragedy that was entirely preventable. I can't imagine what that feels like. And also the correctional officers who were there that night have to live with this. That's also unacceptable. And they are put in a completely unfair situation. And even where, COs are making mistakes, but they're making mistakes inside of a system that is designed for failure, where it's just really a miracle that more of these kinds of things don't happen every day. And the failing is that of the federal governments. So I would urge folks to just cut to the chase, contact Congress. And if you don't want to wait until January or February to send that message, you can send a message today to your representative asking them to send a letter to BIA and to the Public Health Service, encouraging them to initiate this dialogue right now. Because I think really what is lacking in all of this, and it's the word none of us have used yet today, is accountability.
Okay. Nate, you kind of already gave us, but a call to action. Well, actually, wait, let's go back to Brandy. Brandy, if someone needed help figuring out what that email should say, are we going to have any templates or something that they could hook into to make sure they've got the keywords?
Yeah, So first of all you have to do is go to Google. If you're on this, if you're participating in this event right now, I know you have access to a computer. So just Google, House of Representatives and U.S. Senate. Two separate searches. You can find out all the contact information to reach your personal representative, both in the House and the Senate, on those sites. And then if you click on committees, again, on both sites, House and Senate, go to committees, go to appropriations, and regardless, and that will provide you the information of who to send your message to. I really encourage people to speak from the heart. I was once a congressional staffer, and there's a term in Congress for those letters that everybody signs. They're called robo letters, and they're not particularly compelling. They're just counted. How many of that exact letter have we received? What is always compelling is a genuine message of concern, and any story you can share about why this matters to you, your family, your community. Speak from the heart. There is really no magic language other than this, and that is what you want to ask them to do. You never want to just say, well, how you feel and why it's a problem, but tell them what you want them to do. And what you want them to do is to send a letter to BIA and to Public Health Service, asking them how they're going to work together to get medical treatment inside jails, and also how much money does Congress need to appropriate for that purpose. That's it. I think sometimes because these situations are so frustrating and tragic, they feel complicated. This really isn't complicated. We're not trying to build a rocket ship. We're not trying to figure out how many butterflies dance on the head of a pin. We're just trying to figure out how to get nurses, physician assistants, and physicians inside tribal jails like they exist in every other detention facility in the country, whether it's county, city, state, or federal. We know how to do this. The federal government has just chosen not to do this for Native people.
Something that Chris had brought up is the idea of shame, and there are so few resources for the phenomenal health disparities across Indian country. But then within those, you've got very few people to actually fight for a difference in health disparities. And as Brandy had said, then within that, there's the completely voiceless ones, which are the people in the jails. So when you've already got a to-do list as a mom or an elder of 100 things that have to happen, tribal correctional health care may not be in the top 100 that you won't get to in your lifetime. So it helps if those of us who are outside of this system can actually speak up on behalf. This is a matter of justice. This is a matter of human decency. Final words. Who would like to jump in with, say, two minutes of final words? And Charles, I see your question. I do want to just say it's a question about whether elders and spiritual leaders are given access to detainees to help with rehabilitation and redemption to break this unhealthy cycle. I believe this should happen and they should be paid for their services. I think tribes would be completely supportive of that, but we're actually even one step before that, because you don't want a tribal elder to come in to someone who's actively has TB or COVID and bring that elder in there until you know that they're cleared. But I do know that the idea of tribal elders making a difference is something that I've heard among the Apache people, and I think it's been talked about among the Navajo. All right, from that question, let's go back to closing comments. Brandy, your closing comments.
You know me, Thea. You can see my wheels are turning. Well, I'm gonna toss it to Nelson Mandela, who, as we all know, spent time on Robben Island in prison during apartheid. And he's famously quoted as saying, "No one truly knows a nation until one has been inside its jails."
Mm.
And you know what he had in prison on Robben Island during apartheid in South Africa? Free medical treatment.
Mm.
And so I think that if nothing else, that should shame all of us as Americans.
I'm going to go to Nate because Chris, you started us and I want you to be able to finish us. But Nate, final comments.
Yeah, I would just say that, we were able to, the BIA never gave us the names and locations of the 19 people who died in these jails since 2016. We were able to find just through reporting and talking with families. But if someone out there watching or listening and you have a story that you want to share, please reach out to me. You can find my email, Twitter, online, because we'd love to tell more of these stories. And I think they're necessary to tell. So if you have any information that you want to share, please reach out to me.
Excellent. Chris.
Yeah, I just want to say I'm super thankful. I'm pretty sure I said this earlier, but super thankful for Nate's reporting and the work that he did to bring light of this issue to me and my family. It's brought us some closure. The Shiprock jail is now closed. I feel that my brother's death had a huge impact, and I was able to speak up on behalf of my brother to the Navajo police and share, the feelings of myself and my family on the loss of my brother. And I'm just praying very hard that this kind of thing will gain some momentum. And and if they do open up a jail again in Shiprock, I truly believe in my heart that the medical side of thing and also the psychological side, I think that, the officers and the corrections officers, I think they need that training, on how to deal with people and how to reach out for help and to be able to, deny themselves the urge to treat our struggling population as lower than even human beings, so just praying for a resolution here, and thank you very much for this opportunity. I do miss my brother, so rest in peace, Carlos Yazzi, and just praying that that his death won't be in vain, but will possibly be a platform that can be used to help other people to survive another day and possibly overcome the alcoholism, drug abuse, or even just the mental health problems that seem to afflict a percentage of our population on a daily basis.
Thank you. For all of you, thank you for joining us. I'm going to turn this over to Holly for her final kind of closing comments. We are 1 minute from the hour.
Thank
Very
you.
well.
Yeah, thank you so much to all of our panelists for joining us today. And thank you to everyone who's here or maybe watching this later on our website. We really appreciate you being here, hearing this, and helping move things forward. For those of you who are able, Pulitzer Center is a nonprofit organization. So if you are able to support us with any level of contribution, we'd really appreciate it. We're a nonprofit journalism organization, and so we depend on donors to carry on this work. After we close today's session, I hope you'll stay with us just a few minutes longer to take a brief survey so we can help make things better for you, our viewers. Thanks again for being with us today, and we hope you'll join us again soon. Bye for now.
Thank you. Thank you.